Doctors often advise cutting down on sugar or taking medication regularly to manage diabetes, but they rarely explain how crucial proper nutrition is for diabetics. Without the right vitamins, insulin can't function efficiently, nerves weaken, and complications develop faster. The surprising part is that most diabetics are low on these key nutrients without even realizing it. If you constantly feel tired, have body aches, or struggle to control your blood sugar no matter what you try, your body might be missing something essential. Correcting that deficiency could make a big difference in how you feel and how well you manage your diabetes. Let's go over which nutrients matter most and how you can make sure you're getting enough of them every day. A small favor, if this information helps, please subscribe to support our work. Now let's begin with the first one. Number 1, vitamin B6. Most people don't pay much attention to vitamin B6, but for diabetics it's far more important than it seems. When blood sugar levels are high, the body loses B6 faster because the kidneys flush it out along with excess glucose. On top of that, inflammation and oxidative stress, both common in diabetes, force the body to use up even more B6 for cellular repair. High insulin levels can also disrupt how your body processes B6, making it harder for cells to use it effectively. To make matters worse, medications like metformin and certain blood pressure drugs deplete B6 further, which is why so many diabetics end up deficient without realizing it. The tricky part is that low B6 levels don't always show clear symptoms. Feeling tired, dealing with brain fog, or experiencing mood swings could all be signs. One of the biggest red flags is nerve discomfort, tingling, burning, or numbness in your hands and feet. You might also notice muscle weakness or poor coordination, since B6 plays a key role in nerve and muscle function. Dry or irritated skin, frequent mouth sores, and a weakened immune system are other possible signs. In severe cases, B6 deficiency can cause anemia, leading to dizziness, pale skin, and shortness of breath. Low B6 affects many systems in the body. It plays a part in fertility. In men, deficiency can reduce testosterone and sperm quality, while in women, it may lead to irregular cycles or worse PMS symptoms. It can even impact libido, since B6 helps regulate dopamine and serotonin, which influence mood and energy. The nervous system depends on B6 for nerve repair and protection. Without enough of it, nerve damage can progress, causing more pain and slowing recovery. The kidneys also rely on B6 to fight inflammation, and low levels increase the risk of kidney complications. Eye health can decline as well. B6 helps protect the small blood vessels in the retina, and a deficiency may speed up diabetic retinopathy, leading to vision issues. The heart and blood vessels are affected too. B6 helps reduce homocysteine, an amino acid that can damage arteries and raise the risk of high blood pressure, heart attacks, and strokes. When B6 is low, blood vessels lose flexibility, making circulation problems worse. At a cellular level, B6 is essential for glucose metabolism. It helps convert glycogen, the stored form of glucose, into usable energy, allowing for steadier blood sugar levels. Without it, blood sugar becomes harder to manage and insulin resistance can worsen. B6 also supports the production of neurotransmitters, which is why low levels can cause anxiety, mood swings, and depression. It's required for hemoglobin production as well, which carries oxygen throughout the body. Without enough B6, oxygen delivery slows down, leading to fatigue and slower healing. The best way to maintain healthy B6 levels is through food. Chickpeas are one of the richest sources. 1 cup cooked provides about 55% of your daily requirement. Beef liver is another strong source, offering around 50% per 100 grams. Wild-caught salmon provides about 40% per 100 grams, while turkey gives roughly 40% and sunflower seeds around 30% per ounce. These foods don't just boost B6 levels, They also strengthen nerve health, immunity, and metabolism, making them excellent choices for diabetics. If you enjoy gourmet-style meals, there are creative ways to include more B6. A miso-glazed salmon with chickpeas provides over 90% of your daily needs, plus omega-3s for heart health. A French-style beef liver pâté with roasted garlic potatoes gives around 85% of daily B6 along with iron and B12 for better energy. A Mediterranean chickpea and grilled lamb stew with saffron provides roughly 80% of daily B6 while also offering amino acids for muscle repair and immune strength. If you can't meet your needs through diet alone, supplements can help. Look for bioavailable forms like P5P, which your body can use directly. Thorne Research P5P 33 milligrams per capsule is a great option due to its high absorption and nerve support benefits. Pure Encapsulation's vitamin B6 50 milligrams per capsule is another good choice that provides a consistent daily dose. Most diabetics do well with 25 to 50 milligrams per day, but for higher amounts, consult your doctor first. Some foods and habits can make B6 deficiency worse. Refined grains such as white bread and pasta lose most of their B6 during processing, so it's best to limit them. Diets high in sugar burn through B6 faster because insulin spikes increase the body's demand. Alcohol is another problem since it reduces absorption and increases B6 breakdown in the liver. Certain medications, including birth control pills, metformin, and blood pressure drugs, can also drain B6 over time, so replenishing it through food or supplements is essential. Vitamin B6 might not get much attention, but for diabetics, it's a key nutrient. It helps insulin work efficiently, protects nerves, supports the heart, and keeps energy levels stable, making it one of the most important vitamins for managing diabetes effectively. Number 2. Vitamin E. Think of vitamin E as your body's built-in shield, guarding your cells, nerves, and blood vessels from harm. But here's the issue: people with diabetes use it up much faster than normal. High blood sugar causes more oxidative stress, which forces your body to consume more vitamin E to fight cellular damage. Because vitamin E is fat-soluble, it needs healthy fats to be absorbed properly. The problem is that in diabetes, fat metabolism often becomes inefficient, making it even harder to maintain adequate levels. The tricky thing about low vitamin E is that it doesn't always show clear signs right away. The earliest clues might be muscle weakness or poor coordination. Vitamin E is essential for nerve communication, so when levels drop, the signals between your nerves and muscles weaken. You may notice numbness, tingling, or burning sensations in your hands and feet, which can make neuropathy even more painful. If your skin feels dry, irritated, or heals slowly, low vitamin E could be the reason. Eye issues such as difficulty seeing at night or increased strain while reading can also signal a deficiency, since vitamin E helps protect the delicate blood vessels in your retina. If you find yourself catching colds more often than usual, that's another warning sign. Vitamin E supports your immune defense. A shortage of vitamin E can impact nearly every system in your body. It's essential for reproductive health, as it supports both sperm and egg quality. In men, low levels can reduce sperm count and mobility, while in women it can disrupt hormone balance, causing irregular periods or even pregnancy complications. Low libido can also occur because vitamin E supports blood circulation, which is important for sexual function. Your nervous system is another major area affected. Without enough vitamin E, nerve cells become more vulnerable to damage, worsening neuropathy. The kidneys also take a hit because oxidative stress is a key factor in diabetic kidney disease. Vision loss can progress faster since vitamin E protects the retinal blood vessels from deterioration. When it comes to heart health, vitamin E keeps arteries flexible, reduces inflammation, and prevents cholesterol from oxidizing, all of which lower the risk of heart disease and circulation problems. On a cellular level, vitamin E acts like armor. It stabilizes cell membranes and preserves the healthy fats inside your cells, keeping your nerves, muscles, and blood vessels strong. It also helps improve insulin sensitivity by lowering inflammation and allowing glucose to enter your cells more efficiently. Another major advantage is that it restores other antioxidants like vitamin C, strengthening your body's defense system. Without enough vitamin E, your cells become weaker, more inflamed, and more prone to damage, which accelerates diabetic complications. Fortunately, there are many natural ways to boost your vitamin E intake. Sunflower seeds are one of the best options. Just 1 ounce provides about 66% of your daily needs. Almonds are another excellent source, offering around 48% per ounce. Hazelnuts give you about 28% per ounce, making them a simple and nutritious snack. If you prefer vegetables, a cup of cooked spinach delivers about 20% of your daily requirement. Avocados are also great, giving you roughly 15% per medium fruit, along with the healthy fats needed for absorption. If you enjoy gourmet food, there are plenty of delicious ways to increase vitamin E naturally. A Mediterranean-style grilled sea bass with an almond herb crust provides more than 70% of your daily vitamin E and a dose of omega-3s. A Japanese-style roasted duck breast with hazelnut miso glaze delivers around 65%, blending rich flavor with antioxidants. A French-inspired avocado and sunflower seed tartare with truffle oil gives you roughly 60% of your daily intake in one nutrient-packed dish. If diet alone isn't enough, supplements can help fill the gap. The best choice is natural vitamin E, D-alpha tocopherol, which is absorbed better than synthetic types. Pure encapsulations, vitamin E 400. IU soft gels are an excellent option, providing a potent and bioavailable form. Now foods. Vitamin E 400 IU soft gels are another good choice, offering a balanced mix of tocopherols for broader antioxidant support. Most diabetics benefit from 200 to 400 international units per day, but it's important not to exceed that, as too much vitamin E can thin the blood. Certain foods and habits can also make a deficiency worse. Processed vegetable oils such as soybean and corn oil increase oxidative stress and drain your vitamin E levels. Diets high in sugar and refined carbs trigger inflammation, forcing your body to use up even more. Alcohol harms the liver, reducing your ability to store and use vitamin E efficiently. Low-fat diets can be a problem too, since vitamin E requires healthy fats for proper absorption. Even how you cook matters. Overcooking vegetables destroys much of their vitamin E, so it's best to steam them lightly or eat them raw. Vitamin E plays a key role in protecting against diabetes-related complications, yet most people have no idea they're deficient. It helps insulin work better, protects nerves, supports blood vessel flexibility, and reduces inflammation. If your blood sugar has become harder to control, your nerve pain is worsening, or your skin feels drier than usual, you may need more vitamin E. Getting enough through food or supplements can improve circulation, strengthen immunity, and help your body stay more resilient against the effects of diabetes. If this helped, please subscribe to our channel and support our work. Let us know in the comments if you have any questions. Number 3, vitamin C. Vitamin C isn't something most people think about until they run low on it. For diabetics, that happens far more often than expected. High blood sugar uses up vitamin C faster because both glucose and vitamin C rely on the same pathway to enter cells. When sugar levels are high, vitamin C absorption drops significantly. On top of that, diabetics experience more oxidative stress, which means the body needs extra vitamin C to repair damage. Since vitamin C is water-soluble, frequent urination flushes it out quickly, worsening the deficiency. Low vitamin C levels don't always show clear signs right away. Constant tiredness might actually be a signal, since vitamin C helps your cells produce energy. If you bruise easily or your wounds heal very slowly, your body may not be producing enough collagen, something vitamin C is essential for. Other signs include bleeding gums, dry skin, and getting sick more often. Joint pain and stiffness can also worsen because vitamin C protects the cartilage from wearing down. In more serious cases, a deficiency can lead to iron deficiency anemia, causing dizziness, weakness, and pale skin. Being low on vitamin C doesn't just make you tired, it can affect many vital systems throughout the body. Fertility can also suffer in both men and women. Vitamin C protects reproductive cells from oxidative stress. In men, it supports sperm production and movement, while in women it helps maintain healthy ovulation and hormone balance. Low vitamin C can make conception more difficult. Libido can drop as well, since vitamin C plays a role in blood circulation, which is necessary for sexual health. The nervous system struggles without enough vitamin C too. Diabetics are already prone to nerve damage, and when vitamin C levels are low, neuropathy symptoms can worsen. The kidneys also depend on vitamin C to reduce inflammation and oxidative stress. Without it, the risk of kidney disease increases. Eye health is another concern since vitamin C protects the delicate blood vessels in the retina. Low levels can accelerate vision loss in people with diabetes, but the biggest effect is on the heart and blood vessels. Vitamin C keeps arteries flexible, lowers inflammation, and helps prevent plaque buildup. Without it, blood vessels stiffen, blood pressure rises, and the risk of heart attacks and strokes increases. At the cellular level, vitamin C acts as a powerful antioxidant that shields cells from damage caused by high blood sugar. It reduces oxidative stress, one of the key causes of insulin resistance, and supports collagen production, keeping blood vessels strong, skin healthy, and tissues repairing efficiently. It also boosts the immune system by helping white blood cells fight infections. Another important role is regenerating other antioxidants like vitamin E, helping your body's defense system stay strong. When vitamin C is too low, cells become inflamed, age faster, and function poorly, making diabetic complications progress more quickly. The good news is that it's easy to get enough vitamin C from food. Kakadu plums are the best source. Just 100 grams give you over 3,000% of your daily requirement. Acerola cherries come next with about 1,600% per 100 grams. Red bell peppers are another great choice, offering around 200% per 100 grams, while kiwis provide roughly 150%. Strawberries add about 90% per 100 grams and have fiber that helps control blood sugar. If you enjoy gourmet meals, some fancy dishes are packed with vitamin C. A tropical ceviche made with kakadu plums, citrus marinated salmon, and red bell peppers provides over 2,000% of your daily needs in just 150 grams. A Japanese-style yuzu tuna tartare with kiwi salsa gives more than 1,000% in a 180-gram serving with a refreshing mix of acidity and flavor. A French-style acerola cherry sorbet with dark chocolate shavings delivers over 800% of daily vitamin C needs while satisfying sweet cravings without raising blood sugar too much. If food alone isn't enough, supplements can help, but not all forms are absorbed equally well. Liposomal vitamin C is one of the most effective options because it enters the bloodstream efficiently. Live On Labs. Liposomal vitamin C is a top choice for quick absorption. Another reliable option is pure encapsulations, ascorbic acid capsules, which provide a simple and steady dose. Most diabetics do well with 500 to 1,000 milligrams per day, though during illness or high stress, higher amounts can be beneficial. Some habits and foods can make vitamin C deficiency worse. Too much sugar blocks vitamin C from entering cells, so a high-carb diet interferes with its use. Alcohol depletes vitamin C stores and increases oxidative stress. Cooking vegetables at very high temperatures destroys vitamin C, so it's better to steam them or eat them raw. Smoking is another major issue. It burns through vitamin C quickly, leaving your body low on antioxidants. Eating too many processed foods without enough fresh fruits and vegetables also makes it harder to maintain healthy vitamin C levels. Vitamin C is one of the simplest ways to strengthen your immune system, improve insulin response, and protect your heart. It helps prevent diabetic complications like neuropathy, kidney disease, and vision loss. Whether you get it from food or high-quality supplements, maintaining good vitamin C levels can make a real difference in managing diabetes and staying healthy. If you've been struggling with frequent infections, slow wound healing, or constant fatigue, a lack of vitamin C could be part of the problem.